Hey everyone, welcome back to the Tooth Doctor YouTube channel. I'm Trevor and this is the one and only Dr. Peter Yoo, the Tooth Doctor. And today we're going to be talking about what causes tooth sensitivity and what to do about it. So here's a quote: "My extra sensitive toothpaste does not like it when I use other toothpaste." I saw it on the internet. I thought it was hilarious. I thought I'd put it in here just for some fun. And a CBC article reveals that 30% of Canadians have sensitive teeth. What do you think about that?
Well, yeah, you know, I've met people, they've had tooth sensitivity for like 2 years. They don't do nothing about it. You know, sometimes it's just one of those, it's like those kind of chronic pains that you just deal with, and then sometimes you just forget about it. So, you know, that's unfortunate when people kind of just let it go and just have to kind of live with the pain, unfortunately. But yeah.
It happens. And I've done the same thing, live with a pain in my tooth or pain somewhere else, and you just live with it and hope it goes away. But how often, Dr. Peter, do you treat patients for sensitive teeth?
You know what, we do get people that come in. I can't give an exact number. You know, we do get a few, you know, weekly, monthly, that come in with, you know, oh, I can't eat. When I drink coffee, it hurts. You know, this tooth is aching. I can't bite on this tooth, and it's not bad enough where they don't, you know, they take like medicine like Tylenol or Advil, but you know the sensitivity is there where they just avoid, you know, some of the good foods that we like. So,
ice cream.
Yeah, just even ice water, right? So,
right. Yeah. So what is the most common cause of tooth sensitivity?
Well, you know, a lot of people say that it's, you know, recession, you know, when your gums kind of pull away from the teeth and the roots are exposed. There is, you know, cause for that. You know, if your gums aren't healthy, you know, as we get older too, sometimes we get some recession. The roots are made out of the second layer of your tooth, which is called dentin, and they have little holes in them, which I guess allows for the transfer of cold or temperatures into your mouth that causes sensitivity. Other people's, you know, sometimes it's a cavity that's big enough that gets close to the nerve, and that's where, you know, people get sensitive or have that, as you call it, sweet tooth. You know, that's kind of where the saying comes from.
Okay, I didn't know that.
Yeah.
So now, is tooth sensitivity more for occurring in older people or younger people, or does it really matter?
Well, you'd like to think that more so occurs in older people, but I have seen some young people with that, and you know, so when they come in and they're, you know, in their teens or their 20s, it actually surprises me. I was like, what? You know, like a young person shouldn't have, you know, tooth sensitivity. So, you know, it's sometimes intriguing in my mind why that happens. So we do our best to try and resolve, you know, what the cause is and how to, you know, make sure it doesn't happen again.
Cool. So, how does having sensitive teeth affect people's health?
Well, you know, I guess the first thing that comes to mind is just sometimes when you got a sensitive tooth on one side, then all you do is just chew on the other side.
Oh, okay.
Okay? And so you never want to kind of be, you know, one-sided. We're designed a certain way so that you can use both sides of your mouth. You know, you don't want to be just working out one arm and not working out the other and having this huge bicep here but nothing here, right? You know, kind of reminds me of, I don't know, there's this cartoon I remember the guy had a very strong arm, you know, and yeah. Anyways, but yeah, that's just kind of cause some asymmetry, and you just don't want overusage that can cause, you know, just muscle tension, strain, sometimes even TMJ problems. And, you know, worst case scenario is just you're overusing the teeth, and then you cause chipping and fractures and stuff like that.
So is tooth sensitivity a sign of bigger problems?
Usually it is, yeah. You know, I used to think that, you know, sensitivity came from recession. So we have products to help cover those roots, exposed roots. Some people are like, oh, it's due to a cavity. You know, I even met a lady once. It was kind of odd. She came to me, just came to Canada, got a checkup. Actually, just got her teeth cleaned. She didn't want a checkup. She didn't want x-rays. I says, oh, why not? She goes, oh, none of my teeth bother me. They're not sensitive, so I think my teeth are fine. Well, she luckily let me have a quick look at her teeth, and I found 10 cavities.
Oh no.
Okay, so sensitivity is not always a sign that you have a tooth problem. But when you do have sensitivity, there is sometimes more in-depth issues.
Okay.
Yeah.
So what is the best or most common way that you treat sensitive teeth?
Well, we look at different people in terms of what happens. Sometimes they grind their teeth and they worn their teeth down. So sometimes they get sensitive teeth just from even chewing.
Mm-hmm.
So we sometimes try and restore them with either fillings. Sometimes just covering up some of the root exposures can help. But actually, to be honest, one of the biggest things that I've recently learned was through some of my patients that I've seen. I look at a patient and they got a spot sensitive. I'm like, oh yeah, it's because the root exposed. But oddly enough, the tooth on this side has more recession. But why that tooth isn't sensitive? So why is that? And so I kind of did a little bit more, I wouldn't say research, but just personal assessments when I'm looking at patients. And I found out, one of the big things that actually do cause sensitivity is a problem with your bite. Okay. If you're not biting properly, if you have a tooth that's biting a little bit heavier than the rest of your teeth, that causes aggravation of the nerve. Okay. When you grind your teeth side to side, your teeth are designed in a certain way to move and function in a certain way. And so when that doesn't happen, you get basically extra pressure or contact with tooth, which again causes the aggravation, and that causes the nerve to be more alert, and that's where the tooth notices the cold more, notices the hot more, and that the sensitivity can sometimes be resolved from just adjusting the bite to leveling things out to the way they're supposed to function properly.
Okay, wow. And what do you do to do that? Do you just grind some teeth down?
Yeah, we basically look at teeth. We basically, check with we call the articulating paper, or like those papers that have the colored paper.
Okay.
And you bite around and check, and then see where it's high. So usually when a person comes in, it's like, oh yeah, this tooth is sensitive, and I'll check the bite on that tooth. Maybe I'll check the opposite side to see if it's equal, right? Because if it's equal, then maybe something else wrong. But usually the culprit is that tooth. There's a heavier bite. There's a darker mark on the tooth, and so sometimes just a little shave of the enamel. I know people say, oh, don't shave the enamel, but you know what? It's in terms of correcting the bite and evening things out. As dentists, we call it basically occlusal equilibration, basically making sure that everything is matching, and that a lot of times will solve the problem.
Awesome. So what happens if people are using sensitivity toothpaste to try and fix the problem? Is that a good solution in some cases?
My mother goes by it.
Yeah.
I know that a lot of people, they
it's right down there.
Yeah. Okay.
So I'll ask you a question about sensitive toothpaste.
Okay.
So, Dr. Yoo, a lot of patients probably use sensitivity toothpaste, and is that something that you recommend people use if they have a sensitivity problem?
My mother, she likes to brush really hard, get a nice good clean, and yeah, unfortunately, she caused a lot of recession on her teeth.
Okay.
And she stood by it, right? She liked sensitivity toothpaste to help minimize just the ache. She has some ice cream. So it did help, and I think it's useful. I would, to each person their own. Sometimes sensitive toothpaste works and sometimes it doesn't. I do tell patients that have a tooth that's very sensitive, there are certain ways that you should be using the toothpaste.
Okay.
Not just the regular brushing, spit, rinse your mouth, all that stuff. There's some extra things that we would share with patients in terms of how to make the toothpaste a little bit more useful and beneficial. Okay.
Now, what happens if they stop using that sensitivity toothpaste? Will the pain come back the same, or is it, how does that work?
Some people say, yeah, when they stop using toothpaste, the sensitivity comes back. Mm-hmm. So, I would like to think that you never have to be stuck with something for a long, long period of time. But, yeah, sometimes the toothpaste doesn't work. I would honestly say come in, we'd have a look and see what the actual problem is. A lot of times sensitivity is not just because of recession. And so to try and find the actual reason of what's going on, that's our goal, right? So that you should only have to use regular toothpaste. And I know a lot of people, they have, older people, they got, people that have, bone loss and gum disease, stuff like that. And so their roots a lot of their teeth have roots exposed, and they don't have sensitivity. So the question is, why do these people have, majority of the teeth have, their roots exposed, and they don't got sensitivity? There's got to be something else.
So really getting to the root of the cause is a better solution than than a topical solution or treatment. Awesome. So how can people avoid getting sensitive teeth or the sensitivity problem?
Well, if you're going to focus on, the gum disease and the recession, then the biggest thing is just make sure you take care of your teeth, keep them clean, coming into a dentist on a regular basis to make sure that the gum health is good. A lot of times I've seen people, their gums look healthy, but actually the bone inside their gums is actually very poor. So even though the tooth looks like it's completely covered, actually inside there's a deep pocket where the roots are exposed. And so, those are things that are important. You don't just say, oh, I feel my heart, I can feel my heart pumping, and yeah, it's healthy, right? You got to go in, routine checkup. How many people keep forgetting about getting their annual checkups and just, getting their blood pressure taken and all that stuff. Those are things that as medical professionals, our goal is to make sure that things are in the way that are good and healthy and proper, even though things may look like that, they may not be, right?
Right. So, very good. Well, thanks so much for all of your advice today. This was really, really good. I learned something, and I know that people who are watching on YouTube did. So please subscribe to the channel, give us a thumbs up, and we will see you guys next time.